histamine when get released, it increase the blood supply to those areas, and those then they become swells. They become more like fatty and swells, and that gives lot of congestions. And that is the one of the symptoms, or the sign and the symptoms of the cold infections. Like congestion, and then the people try to cough it out. That's congestion, and that, and then the other symptoms. Now the body immune system reacts to that. That when the immune system reacts to that, and then it happens is the mucus is produced. Initially, that mucus is like a thin, clear mucus. But when the immune system produces the antibody, because the virus itself is like an antigen, it stimulates the body immune system, and in reaction to that, the body produces something which is called as the antibody. So with the reaction of the antigen and the antibody, the more mucus is produced, and then the mucus which was initially in reaction to the infection, to the virus, which was clear, later it changed into different colors, become more like a yellowish color, and then change it to the greenish color. The greenish color is actually because of the secondary bacteria or the germs which are produced in the system. But that doesn't mean somebody who has those bacteria is required the antibody, especially for the children. The bacterial infection does require a treatment with the antibiotics. Viral infection do not, because the antibiotics do not help kill the virus. The common symptom, as I mentioned, mostly it is like a sneezing, stuffy nose, runny nose, sore throat, and watery eyes, mild headache, all those things. However, there's a difference in two infections, one with the common cold and the other one the flu. All these signs and symptoms, as I mentioned, they are much more severe in the flu as compared to the common cold. Now, when is the time to see a doctor? If the fever is, in a child especially, if the fever is too high, let's say 101, 101 or higher, or if the symptoms they're lasting more than 10 days, or if they're not relieved by a symptomatic treatment, by resting, taking a lot of fluids, and using like a Tylenol for the fever, if you do not get a relief, even after 10 days, it's better to see the doctor. Or if it's a small child under 6 months age, and even if he has a fever, only 100 degrees or a little higher, it's better. Or if you see the child is getting like he is not eating well, his activity is not less, he's slow, he's getting weak, it's better to contact the physician. Because it's easier for the doctor, to determine whether the child just has a common cold and he just needs a symptomatic treatment, or if he needs further evaluation. So it is better for a small child, if it's in case of a small child, it is always better to consult your physician. Now, the antibiotics, when they are needed, antibiotics actually they not treat the common cold, because the common cold is a viral infection. It's just a waste of money is using the antibiotic for that. However, in some cases, small children or the older people or the people with the chronic infections, they are more prone to get the secondary bacterial infection. Why? Because these viral infections, when the virus gets affected to the body, they weaken your body immunity, and your body become more prone to get the infection. And these viral infections, some children, they do get the bacterial infection, like the ear infection, as well as the throat infection, sore throat, strep throat, you call it. In some cases, especially for the old people who already have chronic lung infection, they may get even into the pneumonia. In those cases, definitely they're required to be treated with the bacterial infection. And at that point, your doctor has to decide when to move in, for the evaluation and for the next step. Now, the treatment, as I mentioned, mostly it is asymptomatic. You just have to give some time. Let the virus complete his course, which is roughly about 1 week to 7 days. The symptom usually starts like about 2 to 5 days after somebody gets the virus. And that is the time when the symptom starts is 2 to 5 days after the virus, when that person or a patient can give it to the other people. And usual course for the virus is about a week to 10 days. But in about 2 weeks, it's all over. The one symptom, which is the cough, usually continue after 3 weeks, and mostly it is like a dry cough. And a lot of people, they usually have tried it over-the-counter cough medications. Most of them, there are 2 different kinds. One is a cough expectorant, one is called the cough suppressant. Now, none of them actually clinically proven to be helpful. It is just for the person or a patient who's like a desperate. So it's give him some kind of a relief, psychological relief that is going to help it. Actually, they are not. The best thing is, for the dry cough treatment is the humidifier, with a warm mist, they do help it. And this has been proven clinically and with the past research in many cases, including there was one study with the CDC. The moist shower, somebody during the night time cannot sleep because of keep coughing, is wake up, take a warm shower with a moist humidified air for 10, 15 minutes or 20 minutes, it definitely gives you a relief. Sometimes the doctor do advise it, if that one doesn't help it, take the other one. And after 2 hours or 3 hours, it definitely gives you a relief. Or there are some medication also which does help, but that requires the prescription from the doctor, like a codeine, because it works as a sedative, and it gives you some relief. It'll cause you sleep, and at the night time you do need a sleep anyway. There are other medications like promethazine. Its brand name is Phenergan, which also has like an antihistamine effect, a sedative effect, and it's also work as an anti-emetic. So all those things, it'll give you relief. But it's only in severe cases. If the other symptomatic treatment, a rest, a lot of fluids, if it doesn't work, and then you go for the medication. And the humidifier at the night time is always work, is good. Just like you taking a shower, which is more difficult, like every 2 hours you're going to get up and run to the bathroom, it's difficult. So humidifier with a moist heat humidifier is also helpful. What it does is, because when you keep coughing is, it's because of the friction in your airways. And the moist air, it does give you relief. It's put just like a coating on the passage, so the muscles for the airways, they get relaxed, so it becomes a little easier to breathe. The other common medication which are available in the market and over the counter without a prescription, there are 2 of them most commonly. One is the antihistamine and the other one is the decongestant. The antihistamine, what they do is, just because I mentioned earlier in the course of the viral infection, there's a release of a chemical called histamine, and that causes mostly the congestion. And when the airways become congested, it's very hard to breathe. So the antihistamine, one of the common name in the brand name is called the Benadryl. There's another one used to be very popular, chlorpheniramine. But they relieve the effect, and they stop the effect of the histamine. So that's how they work. They do not stop producing the histamine, but once the histamine is released in the body, and then they will fade off the effect of the chemical. The decongestant, as the name suggests, they take care of the congestion. They kill the congestion. So those airways, they become clear. of the congestion, and it becomes a little easier to breathe. But all of them, both of those things, especially the decongestant, they do have their side effect as well. In year 2007, in October, most of those medications, especially for the children under the age of 2, which contain this Sudafed, which is a most common decongestant, they were taken out of the market because there was a study done by the CDC, Center for the Disease Control and Prevention, in January of 2007, that almost like over 7,000 cases of the small children under the age of 2, they go to the hospital emergency room every year because of the side effect of those decongestants. And there were 3 cases, 3 children, they were died because of the overdosing of those. Either medication not given under the direct supervision of the parents or the caregiver, or they have just had the side effect and the parents not well aware of the side effect of those medication. So in then October 2007, they were taken out of the market. Some of them they are taken out, but the other manufacturer itself, they just took them out of the market because of the fear that they, there are going to be more cases of these things. Now, how do you prevent, this common cold? The best thing is, the hygiene. The hand washing and the cleaning, keep yourself clean. Alhamdulillah, this is the cleaning and the hygiene is a part of our taqdeer. Some people say that safai iman ka aadha hissa hai. So, every part of the culture or everywhere you go is Islam is there. Alhamdulillah, there is a कहते हैं ना इलाज, हर चीज़ का इलाज जो है वो अपना कुरान मजीद के अंदर है, इस्लाम के अंदर हर चीज़ बताई गई है अपना. So that is there. The hygiene is the best thing. In this one, because the virus itself, it's almost impossible to stop it because it's so much every year. There's so many every year. 20 to 30% of the population get affected. So, but you can take some precaution, like practice a good hand hygiene. Wash your hand. How to wash your hand is, understand. I brought some pamphlet, with some how to take care of the flu and the cold, how to wash your hand, and different methods is. There are some pamphlets if somebody wants to use them. And also avoid the close contact with the people who have the cold or the other respiratory infection, including the flu. Covering the mouth and the nose when you cough, and especially when you have the cold, so that it don't get to the other people. And when you use a tissue, make sure you dispose them off properly. Do not leave them on the surface so the children won't get it. And do not even share the food for the people, especially if they have a flu. Even with the cold, it's good. Good thing is, and having the healthy eating style, and getting the adequate sleep, and a lot of fluids. These are the few things. Now, especially for the children under the age of 6 months. Now, when you talk about the flu, because for the flu, I'm going to read some important instruction about the flu and how to prevent it. But every year, now it is recommended that everybody from children above the age of 6 months, and then everybody, especially old people, they must get a flu shot every year. But currently, the flu shots, they are not recommended for the children or the infant under the age of 6 months. And those are the children, they usually get affected with the flu and with the cold. But since the flu shot is not yet recommended for them, it's not yet been approved, so the best thing is to prevent those children who are actually going to get affected. If we do not take the precaution, is to keep them away, from the people who have the cold or people who have the flu. And keep them away from, the parents should take care of, by the children, keeping them away from them if you have the flu or other caregiver. And those children, especially be conscious when they go to the daycare center and the places like that, because children, they do have their habits, I mean, mingling with each other and playing and using the same toy, so have to be very careful in those things. Now, I have going to say a few words about the flu. The one common flu, one of them is like a common flu, it's called a seasonal flu. And I mean, comes every season. Every winter time in the United States, we come across with the season. And especially in the hospital, other people, the healthcare people like myself, who work in the clinics, who come in contact with the patients, and they must get it, the flu shot every year. Now it is recommended everybody 6 months of age and higher must get a flu shot every year. Now, there are flu shots for other infection, viral infection, bacterial infection. You don't have to get them every year. But for the flu shot, for the flu influenza, commonly is called as flu, you must get it every year. The reason is because the flu virus, every year, flu virus change itself. I mean, it changed from one flu virus to the other, because from one main virus into the subtypes, and then each subtype may change into different strains. That's why it is very important that the flu shot should be every year, because the flu shot you have 1 year is not going to be effective in the other year. One good thing is the last year the flu virus and this year flu virus, according to the research by the CDC, who's really working a good for the public, is that they do a lot of research, and they have found out this year flu, the one which has already been started in this winter, is about the same as it was around in the last year. So it will be easier for the people that you only need one flu shot. But however, sometimes the virus, if abruptly change from one to the other, then the one flu shot doesn't work. Then you may have two flu shots, like 4 months apart, especially in the children. You need a flu shot up to the age of 8 years. From 6 months to 8 years, you may need two flu shots in the same year. However, if it is the same virus running around from one year to the other, not with much difference, then one flu shot is work. But one flu shot is must for everybody. How I don't want to go into that. How does it change from one virus to the other virus? But simple. The thing is, to get the flu shot every year. It is recommended for everybody. Flu shot does not give you the flu. It prevents you from the flu. 5% to 20% of the population every year do get the flu. And there are more than 200,000 people, they are hospitalized just with the seasonal flu, which is a less severe flu as compared to the other flu, which is called the pandemic flu. Like it did happen in the pandemic flu back in 2009, which kills thousands and thousands of the people. The seasonal flu doesn't kill that many people. Seasonal flu because there's already vaccine have been produced, and they are readily available at the start of the season, flu season. For the pandemic, there are no flu shots available, because the pandemic is something, a new totally strain, unknown to the health department, so that they were not prepared. So there is no protection. For the seasonal flu, only affects mostly sick people or the little children. For the pandemic, even the very healthy people, they will get affected immediately, and there is no treatment yet. So that's why it's more severe and it causes more damage as compared to the seasonal flu. And it's easier. Like I gave the precaution how to prevent it for the cold, same common precaution can be used to prevent the flu shots. The flu season usually start the same time as the common cold is. Start mostly in the winter, in the early autumn, and continue up to the spring. I had I'm going to go over to the list about the people who must get the flu shot and must get it every year. Let me simply go over to the list, which looks like I have lost it. No, I found it. Okay. The person recommended for the seasonal influenza vaccine or the flu vaccine. Seasonal, as I mentioned, once you get it every year. And once actually it is not that severe. Everyone 6 months of age and older should get the vaccinated against the flu vaccination, and it should start begin as soon as the season vaccine becomes available. And usually it is become available if it is a regular seasonal flu in the beginning of the season, which is like start somewhere around in the month of September. Now, if somebody did not get the flu shot in the September, and it's already the January or the February or the March, listen, sometime the seasonal flu continue even up to the May. So it is better even you can get it later. It always helps. Now, it says the vaccination particularly important for the person who are at the increased risk for the severe complication from influenza. When vaccine supply is limited, vaccination efforts should focus on delivering vaccination to the following person. Now, if there is a severe weather and a lot of public has been affected, even though when it's available, it's recommended for everybody from 6 month age to the higher. Everybody must get it. However, if a lot of public is affected, then you should give a focus to those people who are more prone to get affected with the flu. Here it says, all children aged 6 months up to 4 years or 59 months of the age, they must get it. They like a first privilege for the vaccination. And then all person age 50 years and older. So from 4 years to 50 years, so then comes the second priority, because there's a shortage. There's a shortage of the flu vaccine. If there's no shortage, everybody from 6 month age and then everybody above. However, when there's a shortage, the small children from 6 months to 4 years. Under 6 months, as I said, because it is not, I won't say that it's not recommended because it's not approved yet, because the safety has not been yet proved that's why, that's the problem. Otherwise, they should give it to everybody. And okay, adults and children who have chronic pulmonary infection like asthma, cardiovascular disease, renal disease, hepatic disease, neurological, hematological disease, or metabolic disorder, like the people with the diabetes, those people who are diabetic, they should also get the first privileges. Adults and children who have immune system suppression, including the immune system suppression caused by medication, are those people who have the HIV. Children and adolescents aged 6 months to 18 years who are receiving long-term aspirin therapy for many reasons, like a Reye syndrome. It is very common in this age to get the Reye syndrome. Reye syndrome is actually caused by the aspirin when it is used on a long-term basis in some viral infection. It may give it, even with the influenza vaccine, the viral infection like the influenza or the common cold, sometimes. Nowadays they don't use it that much, aspirin, but whenever they use it, like a Kawasaki syndrome, they use aspirin really in a very high doses, and sometimes it causes into the Reye syndrome. And they, in those cases, also the preference is given for the flu shot is the American Indians, like the people from the Alaska natives, the person who are obese, are people who are working in the healthcare industry, like the doctors, the nurses. They must get the flu shot, even if it's a shot or not. are those people who are in a contact or the caregiver of the children under the 5 year of age. They must get the flu shots. I think my time is over, and anybody, I mean...
Yeah, you need, if you have questions.
Yeah, okay. Yeah.
There's enormous literature, enormous information in health science. You just cannot say this is it. And Dr. Saab can go on for hours and hours. Few things which you should take home points is that there are 2 peak seasons of flu. One is in the fall, which is starting in September. If you didn't get a shot, you should get it. Second peak comes in February. If it's not, it can go to March and May and even that. There's another thing called swine flu, which has been also popular, which I think Dr. Saab mentioned.
They had it.
And there now vaccine is given as a combined vaccine, 1 shot, and that you should get it. And as he said, 6 months to a certain age, 4 years are very highly vulnerable children. They should get it. Elderly, with any time you have anything which is heart involvement, kidney disorders, these people are prone to get infection. Blood disorders, autoimmune disorders, and also diabetic. These people are prone. And smokers, lung disease, asthmatic. So in other words, is it safe to take the vaccine or not? Studies have so far shown nobody got killed, nobody got hurt, nobody got harmed from these infections, but they are very devastating. They can get you very fast. Effect is very rapid, and it takes on the person's health very bad. If you have any questions, please ask Dr. Saab. If you want the mic, I can give you actually this mic, or if you want, we can have that one to answer.
As Dr. Shah Faruqi mentioned it about the swine flu, as a matter of fact, there's another flu is called as the avian influenza or the avian flu, which is like little more common than the swine flu. And very recently, just a few years back, this was spread through all the world. I mean, you have heard of it, that thousands and thousands of the chicken, they died in different parts of the world, including, I think there was a one in Texas, state of Texas also, and that avian flu is still running around in some parts of the world as well. And mostly it's got, avian flu actually, it is commonly present in the wild birds, but they may get into the regular poultry system with the turkeys and the chicken as well. And sometimes it gets changed, the same virus gets changed and can affect the human being as well.
One of the things which I'm giving to my patients, right, like candies. This gentleman, this is an ENT specialist. His name is Dr. I think Mehta. This gentleman invented this thing. It's really nothing. It's a baking soda. The pamphlets are here. You can take it, and these are the bottles. Very simple thing I tell you. And we in Jersey have a lot of allergies. We have a lot of sinus problems. And I think the best thing you can do to not to see doctors to use this. I have no commission in it. I have no stocks in it. I've never done this thing, but since I've given this, a lot of my patients don't come back to me. This is what you do is there's a bottle, white bottle here you can see, and what you do is you get this blue packet, you buy it, it's over the counter. There's a lot of pharmaceutical, all the pharmacies are carrying it. And your flu shot you can get at any CVS or any pharmacy, you can go and get your shot. Because if you get it, you can pass on to your family. So that's why you need to take the shots, flu shots. Because then if you didn't get sick, you may be strong, but your child and your husband, your wife, your parents living with you, we have a joint family system, we have always people around, so they can give us. That's something very important. And one way, I think kids are told in the school how to cough. When you cough, you put your elbow up here, you cough here. Because when we cough, 14 feet breath of ours goes out in the air. So if I cough right now, so 14 feet, the breath is going to be in the circle, and when you walk through that area, you inhale the virus. It's a respiratory virus, it comes through the airway. And that's when it sits in the back and then goes down into the lungs, and then we start making mucus and phlegm and all that. Often people think we should take antibiotic. Antibiotics do not kill. Virus is a living creature which is not killed by antibiotics. So do not go on antibiotic till your phlegm becomes yellow, discolored, brown, green, red, and sometimes when there's a little blood in it, it looks like it's green or maroon color. Phlegm can be discolored. Once the phlegm gets discolored, or you get fever, or chills, or shaking, rigors, shaking chills, you need antibiotic. Don't take antibiotic till then. So this is going to help you. So this bottle, this is a pediatric size bottle. You fill the water with the distilled water, put that packet. There are 3 types. I think the pink is for the, or orange color is for the children. For adults, it's a blue color. You put it in there, you flush it to your nostril. Here, there's a tube in there. You squirt one here and one here. till you finish it. Let it drain. If you swallow something,